This multivitamin product is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and help maintain good health. It is important to take this medication as directed by your doctor. The usual dosage is 1 tablet daily with a meal. It is best to take this medication at the same time every day to help you remember. It is important to follow your doctor's instructions carefully in order to get the most benefit from this medication. When taking Multivit, Stress Formula-Zinc tablet, it is important to take it by mouth, usually once daily or as directed by your doctor. Be sure to follow all directions on the product package and do not exceed the recommended dosage. Taking this medication regularly will help you get the most benefit from it. Try to take it at the same time each day to help you remember. If you have any questions, be sure to ask your doctor or pharmacist for guidance. Some common side effects of Multivit, Stress Formula-Zinc tablet include constipation, diarrhea, or upset stomach. However, these effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, be sure to notify your doctor or pharmacist. It's important to note that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. In fact, many people who use this medication do not experience any serious side effects. While a severe allergic reaction to this medication is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not mentioned here, it's best to contact your doctor or pharmacist. As for the optimal timing and dosage, it's best to follow the instructions provided by your doctor or on the product packaging. And remember, if you have any concerns or questions about the side effects or usage of this medication, don't hesitate to reach out to your healthcare provider. It's important to keep multivitamins with iron out of reach of children, as accidental overdose of iron-containing products can be fatal for children under 6 years old. If overdose does occur, seek medical help immediately or call a poison control center. Before taking Multivit, Stress Formula-Zinc tablet, it's important to speak with your doctor or pharmacist if you have any allergies to its ingredients or if you have a history of alcohol use or liver, stomach, or intestinal problems. If your multivitamin contains folic acid, be sure to notify your doctor if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia. It's also important to inform your doctor about all the products you use before having surgery and if you are pregnant or breastfeeding. It's important to be aware of potential drug interactions that may affect how your medications work or increase the risk of serious side effects. To minimize the risk, keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Ask your doctor or pharmacist about the recommended waiting time between doses and for assistance in creating a dosing schedule that will work with all your medications. If your multivitamin contains folic acid, inform your doctor or pharmacist if you take certain anti-seizure drugs. It's important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are taking this medication. If you suspect an overdose, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to keep all your medical and lab appointments while taking Multivit, Stress Formula-Zinc tablet. Some brands of this medication may also contain ingredients such as docusate. If you have any questions about the specific ingredients in your brand, be sure to ask your doctor or pharmacist. Remember, this product is not a substitute for a proper diet. It's best to get your vitamins from healthy foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. And always remember to take this medication as directed by your healthcare provider. If you miss a dose of this product, take it as soon as you remember. If it is near the time of your next dose, skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. It's important to store Multivit, stress Formula-Zinc tablet at room temperature, away from light and moisture. Be sure to keep it in a safe place, out of reach of children and pets. If the product is expired or no longer needed, make sure to properly discard it. It's best to consult your pharmacist or local waste disposal company for guidance on how to do so responsibly. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.